Andrew Balder. I'm a physician in primary care, both adult and pediatric care. I have been fortunate enough for more years than I can count to be on staff at Mason Square or Bay State Mason Square Neighborhood Health Center, currently as interim medical director. Social justice means different things to different people, and I think it's an internally evolving concept. Social justice to me is more than just equality of opportunity, but it is really the level playing field for all as much as we can make it, and not just that it's a field we can play on, but that we take and accept those who have not been provided the same opportunity as I, for example. Much more of an opportunity, a boost, a lifting up, something that doesn't allow people to get hurt along the way by society and its rules and structures. Through work in Project Baby Springfield Fetal Infant Mortality, one of the things that I realized is that infant mortality and pregnancy outcome tells us as much or more about the health of our society, our city, and groups or identified groups within the city as any other single measure you can put your finger on in health. When you see that, you say there is something wrong and something unjust here, and it's not just biologic. It has something to do with how we treat people, how we alienate people, how we accept people, how people value themselves and are valued by the rest of us. Then you take 25 plus years of experience in Mason Square with more of an adult population and look at what comes in the door, and you start to realize that people just have not had not just the same opportunity, but pardon the way I put it, that we have this great tendency in this country to exploit and screw people. And that is fundamentally unjust. Our system is, unfortunately, exploitative in its economic nature, and we've yet to overcome that. And through that system, we thereby marginalize and alienate whole groups of people who aren't accepted by that mainstream. And it's unfortunate that that happens in any country, and in ours. It ebbs, it flows, it gets better, it gets worse, but it never goes away. Like any award, it's a surprise. And like most awards, it's a very gratifying surprise because it says that others have recognized the value of work that's been done. And we don't work in a vacuum, so it's not just as an individual, but sometimes as an individual you're elevated to receiving a recognition that really belongs to the shoulders of those on whom you stand. We are about to move into an era of what's called accountable care prospective payment, an exciting opportunity to stop viewing health and healthcare myopically in one silo as just what I do when I see a patient and write a prescription, but what we do as a system to improve social circumstances, improve self-care, improve care coordination, to take a much broader, holistic, and comprehensive look at what health really means and how to get there. Every woman and every family to be in Springfield is valued by our community, regardless of where they come from and what they look like. Support and foster healthier pregnancies and healthier infants and young families. And if there were anything that I'd hang my hat on as of most value, it would be that.